Hello everyone, I am Dr. Swati Mehta, welcoming you all on my YouTube channel. Today, we are going to learn about newborn care and important neonatal complications from a homeopathic perspective. This presentation includes newborn management, physiological changes after birth, neonatal emergencies like asphyxia, ophthalmia neonatorum, jaundice or icterus neonatorum, low birth weight babies, birth injuries, and detailed homeopathic therapeutics. So let us begin this important educational journey. Immediately after birth, proper care of the newborn is extremely important. The umbilical cord should be clamped and cut only after pulsation stops. This ensures adequate blood transfer from the placenta to baby. Improper ligation may lead to a severe blood loss in the newborn. Normally, the blood volume of a full-term baby ranges between 80 to 100 milliliters per kilogram of body weight. Careful cord management is the first step towards safe neonatal care. The condition of the newborn is assessed using the Apgar score at 1 minute and 5 minutes after birth. This scoring evaluates heart rate, respiration, muscle tone, reflex response, and skin color. A score above 7 indicates a healthy baby. A very low score suggests birth asphyxia and the need of immediate resuscitation. Most babies begin breathing naturally within 3 minutes after the birth. After stabilization, the baby examined carefully for general health and adaptation to the extrauterine life. Vital signs, breathing pattern, skin color, reflexes, and activities are observed closely. Early identification of abnormalities improves neonatal survival and long-term outcomes. So, Apgar scoring system, APGAR, A for activity, P for pulse, G for grimace, that is reflex, A for appearance, and R for respiration. So we have to remember APGAR when we are examining the baby. The newborn should be examined thoroughly for congenital abnormalities. Special attention is given to the head, spine, limbs, palate, genital organs, and heart sounds. Early diagnosis of congenital defects allowed prompt treatment and counseling for the parents. Many physiological changes occur after birth. Physiological jaundice commonly appears between the second and fifth day. Meconium stools are passed during the first few days. Urine should normally pass within 24 hours. Temporary breast swelling or vaginal bleeding may occur due to maternal hormonal withdrawal in female child. Weight loss during the first few days is normal and birth weight is usually regained within 10 days. The first complication of a neonatal after birth is asphyxia neonatorum. It is also called birth asphyxia. It occurs when the baby does not receive enough oxygen before, during, or immediately after birth. This condition can cause severe brain injury or even death if not treated immediately. Early recognition and rapid management are essential. Asphyxia neonatorum means failure to establish proper breathing at birth. The literal meaning is stopping of the pulse. The baby fails to adapt to independent respiration after delivery. Several factors can cause neonatal asphyxia. The airway may become blocked, labor may be prolonged, or the umbilical cord may wrap around the baby's neck. Maternal infections, anemia, abnormal blood pressure, and placental separation also reduce oxygen supply to the fetus. Antenatal causes includes placental insufficiency and preeclampsia. During labor, prolonged difficult delivery, trauma, anesthesia, or drug may contribute. After birth, prematurity, congenital anomalies, or brain trauma may lead to respiratory failure. In primary asphyxia, the baby appears blue but still has some muscle tone and heartbeat. In secondary asphyxia, the condition becomes critical. The skin becomes pale, gray, heartbeat weakens, and muscle tones disappears. Without urgent treatment, brain damage or death may occur. This slide demonstrates the clinical appearance of a baby suffering from severe birth asphyxia. Immediate resuscitation and oxygen support becomes life-saving measures. The baby may appear pale or bluish. Breathing becomes difficult, heart rate slow, and muscle tone weakens. Meconium stem amniotic fluid may also indicate fetal distress. So when baby is pale white, that means lack of oxygenation intrauterine. And if baby is bluish, then there is a lack of oxygenation after the birth. Baby cannot able to establish proper respiration. Management begins with clearing mucus or meconium from the mouth and nose. The baby is dried and kept warm. Oxygen support, mouth-to-mouth breathing, and cardiac massage may be required. If needed, the baby is placed in an incubator for temperature maintenance. Now let us study important homeopathic remedies useful in neonatal asphyxia. Carbo Veg is one of the most important remedies for collapse states. I have used this medicine during my 40 years practice many times, and thousands of the newborn were helped with this medicine. Even my nursing staff knows that one drop of Carbo Veg 30 when we are putting on the tongue of a newborn who is having asphyxia, the bluishness disappears within seconds and baby will breathe very normally. It is indicated when vitality is nearly exhausted, the baby becomes cold, bluish, and breathes weakly with cold sweat and imperceptible pulse. There is poor circulation and lack of oxygenation. This remedy is often called the corpse reviver because of its usefulness in extreme collapse conditions. So deficient capillary circulation causes blueness of the skin and coldness of the extremities are the indications of Carbo Veg, and bad effects from the loss of vital fluids or hemorrhage means when patient is having improper umbilical ligation and patient has bleeding, then also we can use Carbo Veg to survive the baby. This is the second medicine which is used by me in many of the cases where there is a rattling of mucus in the chest. Means when we are clearing out the throat and mouth, but it is improperly cleared out, then we can find out the rattling, and because of that the baby develops cyanosis. So difficult breathing is there. The child appears weak, cyanosed and covered with cold sweat. Respiration is rapid, short and labored. The lung seems filled with mucus, but the child lacks the strength of the expand it. That means when we are putting chest piece of the stethoscope on the chest of a baby, you can find out the wheezing sound. And there is incision quivering of chin and lower jaw. The baby's lower jaw movement is very, you can say finely you can find out it is very high. And edema and impending paralysis of the lungs may be possible. In this case, we can use Antimonium Tartaricum. Opium is useful in deep coma states. When baby is in coma because of the prolongation of the labor or exhausted baby, we can use opium. The baby may have loud snoring respiration, unconsciousness, hanging of the lower jaw, and complete insensibility. It is indicated in profound nervous depression followed birth trauma or asphyxia. Another complication of newborn is ophthalmia neonatorum. It is a conjunctivitis occur within the first month of life. It may result from bacterial infection acquired during delivery. It is untreated can damage the vision permanently. Most of the time, the gonorrheal infection is the cause of ophthalmia neonatorum. Common causes include sexually transmitted infections like gonorrhea and chlamydia from the mother. Other bacteria such as Staphylococcus, Pseudomonas, and Klebsiella may also infect the eyes. Blocked tear ducts and chemical irritation may contribute as well. The baby develops redness and swelling of the eyes. Discharge may be watery or pus-like, or there may be crusty. The eyelids become swollen and sticky. Let us discuss important homeopathic medicines used in ophthalmia neonatorum. Argentum Nitricum is useful in purulent eye infection with marked swelling and redness. There is a profuse discharge, ulceration, and sensitivity of the eyes. It is especially valuable in acute conjunctivitis with corneal involvement. Most of the time, right side is affected, then we can use Argentum Nitricum. That is acute granular conjunctivitis, means the discharge is granular and crusty or crusty. There is inability to keep the eyes fixed steadily. Paretic conditions of the ciliary muscle of the eyes. Cornea is opaque and there may be ulcers in the cornea. Mercor is indicated in severe ulcerative eye conditions. There is acrid lacrimation, swollen eyelids, corneal ulcers, and intense inflammation. It is useful when infection is deep and destructive. So, iritis, ordinary or syphilitic, we can use this medicine. Retinitis, albuminuric, ophthalmia neonatorum, where the lids edematous, red, excoriated, we can give this medicine. And it can be given in association with atropine locally for prevention of the adhesions. Hepar sulph is prescribed in purulent conjunctivitis with extreme sensitivity. The eyes are red, painful, and discharge are thick pus-like. The child cannot tolerate touch or cold air. Iritis with a pus in anterior chamber, if you can find out by the CT scan, we can use this medicine. Pulsatilla is helpful in bland yellow discharges with inflamed sticky eyelids. Symptoms aggravated in warm room and improves in open air. This remedy suits to gentle, clingy children with yellow secretion. Lids are always inflamed and agglutinated. Veins of the fundus oculi greatly enlarged when we are observing. The eyes, there is subacute conjunctivitis with dyspepsia, worse in the warm room. So baby is having also some gastric complaint. There is crack in the middle of the lower lip. That is also one of the indication of pulsatilla. Syphilinum is considered in chronic syphilitic eye affections. The eyelids become swollen, painful at night, and associated with corneal inflammation or ptosis. Means patient cannot able to keep the eyelids up. That is known as ptosis. And there is tubercular iritis. That means the mother or father is having history of tuberculosis. The baby can develop this. Excessive flow of saliva, it runs out of the mouth when sleeping, is one of the indication of syphilinum. The third complication is neonatal jaundice or icterus neonatorum. Neonatal jaundice is very common, especially in premature babies. It occurs due to elevated bilirubin level in the blood. If bilirubin rises excessively, it can damage the brain. The baby skin and eyes appears yellow. Neonatal jaundice are non-obstructive and There are two types we can consider: physiological jaundice and pathological jaundice. Physiological jaundice will occur after 72 hours of the birth of the baby because of the excessive blood is converted into destruction and bilirubin level will high, but it will subside within 1 or 2 days. If it is not subside, then we have to find out the cause. The causes are immaturity, birth hypoxia, blood group incompatibility, bruising or injury. Infections are the common causes, and we have to rule it out if the jaundice persistent after 3 or 4 days. The investigation of neonatal jaundice: blood grouping of mother and baby is must. Coombs test, hemoglobin level, and serial bilirubin estimation helps to determine the severity and cause of the jaundice. Management includes adequate feeding, prevention of prematurity, and phototherapy. Phototherapy is must and it is required. When there was no any instrument of phototherapy, the doctors advised to take the infant in the sun rays early morning. So in severe cases, exchange of transfusion of the blood may be required. Let's study the homeopathic remedies which are useful in neonatal jaundice. Natrum phos, which is indicated when the baby has yellow discoloration of skin and eyes with creamy yellow coating on the tongue. Golden yellow eye discharge and digestive acidity may also be present. Now you can consider that how can you know acidity, because baby cannot speak, but the stool, the eructations and the flatus, from that we can make out the baby is having acidity or not. And there is typical symptom, that is dilatation of one pupil. Chelidonium is an important liver remedy. It is indicated in jaundice associated with liver and gallbladder dysfunction. The skin, eyes and tongue becomes yellow. Stool may appear a clay color. So if we can palpate a liver in newborn, or we can find out some pain around the gallbladder area, we can consider chelidonium. The peculiar symptoms are flapping of Alanazi and tongue yellow, large and flabby. There is distension of abdomen. So these are the peculiar symptoms of chelidonium. Lupulus is a peculiar specific medicine for infantile jaundice. It is written in a boric. Patient is having drowsiness, slow pulse, twitching of muscles, nausea and stupor. Another complication is low birth weight babies. A low birth weight baby's weight less than 2.5 kg at the birth are known as low birth weight babies. This may result from prematurity or intrauterine growth restriction. These babies require special care and monitoring. This slide demonstrates the appearance and care needs of low birth weight babies. Poor maternal nutrition, habit of smoking and alcohol, hypertension, diabetes, infection, and inadequate pregnancy care are important causes of low birth weight babies. Placental abnormalities, multiple pregnancy, low amniotic fluid, congenital infections, and chromosomal abnormalities may also restrict the fetal growth. Growth restricted babies face higher risk of hypoxia, hypoglycemia, pneumonia, neurological delay, and learning disabilities. So IUGR, that means intrauterine growth retarded. Good antenatal nutrition, prenatal vitamins, avoiding smoking and alcohol, and proper control of maternal disease help to reduce the low birth weight baby. This slide shows the sign and symptoms and classification of the low birth weight baby with its treatment. This slide illustrates supportive neonatal care and monitoring strategies for vulnerable newborns. Another complication, that is restriction of growth. Growth restriction may be asymmetrical or symmetrical. Asymmetrical babies usually recover growth rapidly after the birth. Symmetrical growth restriction often results from genetic or congenital causes. This slide introduces the major complications seen in low birth weight and premature babies. Premature babies commonly suffer from hypothermia, respiratory distress, jaundice, and infections. Growth restricted babies are prone to hypoglycemia, hypocalcemia, and meconium aspiration. Another complication is intracranial hemorrhage. This serious condition involves bleeding inside the brain, commonly seen in premature babies. Symptoms include limpiness, cyanosis, seizures, and unconsciousness. Survivors may develop long-term neurological damage. This slide shows the pathological and clinical features associated with intracranial hemorrhage. The exact cause is uncertain, but prematurity, birth trauma, hypoxia, coagulation defects, and respiratory distress syndrome are important contributory factors for intracranial hemorrhage. The homeopathic medicines for intracranial hemorrhage are Arnica and Natrum Sulph. Arnica is a valuable after birth trauma with hemorrhage and bruising. It helps to absorb the clots and reduce the cerebral congestion. Natrum Sulph is useful after head injuries with neurological symptoms, congestion, and spinal irritations. So whenever we are using forceps or a vacuum, immediately we are giving Natrum Sulph 1 dose to the baby to prevent intracranial hemorrhage. Caput succedarum is a temporary swelling of the scalp which is caused by the pressure during labor. It usually disappears naturally within few hours or few days. Caphel hematoma is a bleeding beneath the periosteum of the skull bone. It appears hours after the birth and should never be aspirated. Most cases resolve naturally within weeks. In homeopathy, arnica is the best medicine which is having capacity to absorb the clots and absorb the bleeding. So it will accelerate the natural power and the baby can become normal or natural within few days rather than the weeks. Birth injury or birth trauma includes a fracture of the clavicle, humerus, or femur. Damage to the brachial plexus may lead to Erb's palsy or clumps paralysis. Forceps delivery may rarely cause skull depression, fractures, or a facial nerve paralysis. Most facial paralysis recover within days, and sternocleidomastoid swelling may later cause torticollis. Here also, in my practice, 40 years practice, those who are my students, who are my followers, they know that I did many of the forceps deliveries and not a single case is having any fracture history or facial palsy history or any sternocleidomastoid tumor, because immediately after the delivery of baby we are giving natrum sulph to the baby, and then after we are giving arnica at least for 3 days. So if any internal hemorrhage or any destruction is there, that will be covered up with the arnica and all the cells damaged are recovered again. These slides demonstrate various neonatal complications birth injuries and management approaches important for the medical understanding. This first slide shows brachial plexus palsy, why it occurs or how it occurs, and what are the symptoms. You can find it out in this picture. House paralysis is also a complication of the injury of brachial plexus and facial nerve. And here, when baby will cry, we can find out the complication or the symptoms. Most of the time, when we are delivering a baby vaginally, in case of breech presentation, there are chances of injury and the fracture, or there is a brain injury. We can see here when we have to do the post head delivery with forceps. This picture shows the shoulder dislocation. This also possible when we are allowing patient who is having breech presentation. Normally we have to take out the hands, and by pulling out the hands we may injure the baby. Sometimes in vertex presentation also, when the head is coming out, immediately we are trying to take out the hand, which may be anaphylaxis condition, and chances of this injury is possible. Again, broken collarbone or there is a painful bruising are the injuries where there is a prolongation of labor, the cervix is not fully dilated, or mother is not pushing properly. This injury can be possible. Thank you for watching this detailed presentation on newborn care and neonatal complications with homeopathic therapeutics. If you found this video useful, please like, share, and subscribe to the channel for more educational medical content. Don't forget to press the notification bell icon for further updates. Thank you once again.